maybe share with me how the Medicaid, entry into the Medicaid would bring in $15 million additional?
That's my understanding from the presentations that I have heard. And that is that by investing in not only the Medicaid, but also enrolling more people into the Sendero insurance program, makes it possible for us to draw down funds to bring into this community. And I don't understand.
Is that Medicaid or insurance? Sorry.
Both of them.
So that 15 million would be both? Okay, so do you know Medicaid alone?
I think there's different amounts for the
it's important
Sendero
for us to know those
enrollees
amounts,
and then for the Medicaid.
But we're talking about the budget. So what is the amount for Medicaid, I guess, from the presentations you saw?
I don't have that total information. I just have the knowledge that can be done.
Who gave those presentations? Or I guess what's the data founded from?
When y'all make presentations to the court?
Oh, we presented that there would be a $15 million upside to entering into Medicaid?
Mm-hmm.
Okay.
And those are estimates, of course.
Understood. No, I just wanted to know the data behind those estimates and, because I don't remember seeing any presentation that said there would be a 15 million Medicaid upside.
And I think what concerns me is the hesitancy to draw down on federal funds that belong to this community. We do the community survey program to see what the needs are by people in the community. And then we realize that some of that, in order to draw down federal funds, and why is there a hesitancy to do that? We also show
I understand, Commissioner Gomez. I just want to ask some questions.
Yeah,
so the next question is around the.
Were you finished responding, Commissioner?
I don't think she was asking questions. She was asking why. I wasn't.
I heard her still talking.
No, I understand. I just, given time and what we saw with the limitations of time specifically at the Commissioner's Court, I think we can all respect that we, have some pretty specific items that we need to cover here that are crucial to the care of many individuals. And so the next question was around specifically I think I heard a number that we could bring up to 32.6 million from the chat program. And do you know where the numbers from that came from either?
It comes from presentation, I think, that we had from Sendero, and then previously presentations by the Central Board to the Commissioner's Court.
Okay. And so in the absence, so right now, for example, Medicaid is being provided through another insurer. In the absence of a change, what is, in your opinion, the impact of that?
That it comes back to help further health needs of indigents.
Yeah, how does that work exactly though?
Yeah,
I mean, it's like one insurer versus another insurer. Right now, Medicaid is happening, right? So how does that work?
I don't have those details, but I think I would suggest to the board that you look into those possibilities.
Okay.
Because you have more access to that information than I do.
Right, which I think is a very important point. We have more access to that information than you do. I think secondarily, you mentioned that Central Health controls the Sendero board. And this is something of a continuance of our conversation from last Tuesday, which surprised me quite a bit. As far as Central Health controlling the Sendero organization, you're saying that it controls the Sendero organization because there are board members affiliated with Central Health on the Sendero board, is that right?
Oh, absolutely.
And so by virtue of that, as you said, the county has the oversight, i.e. the court, and thank y'all for y'all's service. You have the oversight over the voluntary board who manages the Central Health organization. So who then of course manages the voluntary board over the Sendero organization. Are we saying that basically you control the Sendero board? Or how does that work?
Well, I guess to say control, I guess we do when we have oversight over your budget and your tax rate.
Mm-hmm.
I mean, it's us who have to vote on those.
Right.
As a final decision.
And is there a danger in that, or is that good? Is that a good process?
That's the way the legislation is set up.
Right.
So
okay. Yeah, that's how it's set up, right?
That's
and that's also how the structures of Sendero are set up with a cascading similar governance model. So if it works at a top level, what is your concern with it cascading down? It seemed as if there was like some concern of a nefarious special interest or something like that. So I'm
Well,
curious about that.
I think the issue that is brought up is that we look to the purpose of the legislation.
Mm-hmm.
Go to that, and it specifically says it's to address the health care of indigents
Mm-hmm.
in Travis County.
Mm-hmm.
And so whatever y'all have set up to set up a process for enrolling
Uh-huh.
the indigent,
Uh-huh.
and if Medicaid helps them and they want to apply for it, why would the board oppose their application?
Well, I don't know why. I haven't seen anyone who opposes anyone's Medicaid. Are you talking about indigent folks who can apply for Medicaid?
I believe Sendero had to apply, according to the newspaper story that I read,
Mm-hmm.
to apply, to ask permission to apply for Medicaid, and the board turned them down.
The Sendero board turned them down.
No. Well, maybe the Sendero board turned them down, but this board also, the newspaper story said that it came to this board and this board turned them down.